Most likely, every time you go to the doctor for diabetes you hear the same thing. Eat less sugar, take your medicine as prescribed, and try to eat better. One thing you may have noticed is that doctors don't talk much about how important vitamins and proteins are for people with diabetes. It's almost like this important part of managing diabetes isn't being talked about. A lot of people with diabetes don't know that not getting enough of certain vitamins can make insulin less effective, weaken your nerves, and make problems happen faster. Even if you take your medicine and watch your sugar, what if you still feel tired, achy, or like you can't control your blood sugar? It's annoying, isn't it? Because the truth is, your body may be lacking an important mineral. Filling in these gaps can greatly improve your health and speed up the management of your diabetes. We'll talk about the most important vitamins and how to make sure you get enough every day. Please subscribe to help our work if you find this useful. First, let's talk about B6. It's not something most people think about, but for people with diabetes, it's very important. When you have high blood sugar, your kidneys flush out B6 along with the extra sugar. This makes you lose it faster. People with diabetes often have inflammation and worry, which use up more B6. Some diabetes drugs like metformin and blood pressure pills can make your B6 level drop even more. It can be hard because you might not know right away that you need more B6. Low B6 could be the cause of feeling extra tired, having brain fog or mood swings. Hands and feet that tingle, burn, or feel numb are also signs. So can muscle weakness or trouble coordinating your movements. Nerve and muscle health depend on B6, so if you don't get enough, these issues may get worse. Skin that is dry or itchy, mouth sores, or a weaker immune system are some other things you might notice. Low B6 can lead to anemia, which can make you feel pale, dizzy, and short of breath. Because it helps control hormones and energy, B6 has an effect on many parts of your body, such as your libido and pregnancy. It also helps your nerves heal, keeps your kidneys healthy, and keeps your eyes and heart safe. If you don't get enough B6, it can be harder to keep your blood sugar in check, and you may feel more worried or sad. Beans, beef liver, salmon, turkey, and sunflower seeds are some of the best foods to eat to get B6. Some of these foods are also good for your brain, immune system, and metabolism. Miso glazed salmon with chickpeas or beef liver with potatoes are both fancy meals that are full of B6. If you don't get enough from food, P5P pyridoxal 5-phosphate supplements can help. But before taking bigger doses, you should always talk to your doctor. If you don't get enough B6, it can get worse if you eat a lot of white bread, sugar, or booze. To be healthy, eat whole foods and stay away from too much sugar and alcohol. Remember that vitamin B6 is very important for people with diabetes because it saves nerves, keeps your energy steady, and helps insulin work better. Alright, let's talk about E. You can think of vitamin E as a natural shield that keeps your cells, nerves, and blood vessels safe. High blood sugar makes the body more stressed, so people with diabetes use up vitamin E faster. To protect against damage, you need more vitamin E. It is important to know that vitamin E can only be taken by healthy fats. However, diabetes can make it harder to absorb fats. At first, low vitamin E may not show any clear signs, but over time you may feel weaker muscles, have trouble coordinating your movements, or have worse nerve pain. It's possible that your skin will feel dry or heal slowly. You may also have trouble seeing or get sick more often. A healthy sexual life, hormone balance, and fertility depend on vitamin E. It also keeps your brain, kidneys, eyes, and heart healthy. It helps keep your arteries open, lowers inflammation, and stops cholesterol from making heart disease worse. Vitamin E is like armor for your cells. It keeps them from getting hurt and makes insulin work better. Plus, it makes other antioxidants like vitamin C work better. Your cells get weaker and more inflamed when you don't get enough vitamin E. This makes diabetes problems worse. Some foods that are high in vitamin E are bananas, spinach, almonds, hazelnuts, and sunflower seeds. Gourmet foods like avocado and sunflower seed salad or grilled sea bass with an almond crust are also great sources. Don't take too much vitamin E because it can thin your blood. Instead, take natural vitamin E tablets if you need more. Some habits like eating too much sugar or processed oils or drinking booze can lower your vitamin E levels. To get enough of it, eat whole foods and healthy fats. To get the most vitamin E out of veggies, lightly steam them or eat them raw. If you have trouble with your blood sugar, nerve pain, or dry skin, you might need more vitamin E. This vitamin helps insulin work better, protects your nerves, and keeps your blood vessels healthy. That's not the end of the story though. Even more nutrients are very important for managing diabetes. Knowing how they work can give you a lot more power over your health than you ever thought possible. Imagine having more energy, less pain, and better blood sugar levels when you wake up. This would happen because you're not just taking your medicine, but also giving your body the nutrients it needs to grow. To improve your diabetes health, you need to do more than just cut back on sugar and pills. You also need to learn about your body and give it the tools it needs to heal and protect itself. Keep watching if you want to learn more about how small changes in your food and way of life can make a big difference. The next vitamin we'll talk about could be the missing piece you've been looking for. As a group, we can make life with diabetes easier, healthier, and more hopeful than ever. Don't forget to subscribe and join our community. As we continue our road to better diabetes health, let's talk about vitamin C, which is an important vitamin that people who have diabetes often forget about. When most people are sick, vitamin C is the last thing on their minds. But for people with diabetes, vitamin C does a lot more than just help their immune systems. You can count on it to help your body deal with everyday problems like high blood sugar, inflammation, and oxidative stress. Vitamin C is lost a lot faster when your blood sugar is high. You might not know this. This is because glucose and vitamin C both get into your cells through the same route. A lot of sugar in your blood makes it harder for your cells to take vitamin C when your blood sugar is high. Plus, people with diabetes pee more often, which makes water-soluble vitamins like vitamin C leave the body even faster. Because of these two things, it's easy to not get enough vitamin C and not even know it. If you have diabetes and feel tired all the time, get bruises easily, or find that cuts and scrapes take a long time to heal, your body may be lacking vitamin C. Other common signs are gums that bleed, skin that feels dry, and getting sick more often. Vitamin C helps protect your cartilage and keeps your joints moving smoothly, so you might even feel stiff or painful joints. Anemia, which makes you feel faint, weak, and pale, can happen if you don't get enough vitamin C. But not getting enough vitamin C has even worse effects. This vitamin helps keep hormones in check and protects reproductive cells, which is important for both men and women who want to get pregnant. It helps the blood flow, which is valuable for healthy sex. Problems with your eyes and kidneys are more likely to happen if you don't get enough vitamin C. Nerve damage can also get worse. Vitamin C helps keep your arteries open, lowers swelling, and keeps you from getting heart disease and strokes. It is a strong antioxidant that keeps your cells from getting hurt by high blood sugar. It also helps your body make collagen, which is good for your skin, blood vessels, and organs. Besides that, it makes your defense system stronger and helps antioxidants like vitamin E do their job better. If you don't get enough vitamin C, your cells get swollen and age faster, which speeds up the development of diabetes problems. If you know what to eat, it's easy to get enough vitamin C. Foods that you may already like are some of the best places to get vitamin C. Kakadu plums are the best. 100 grams of them gives you more than 3,000% of your daily needs. That's a huge amount. Another powerhouse is acerola cherries, which give you about 1,600% per 100 grams. Red bell peppers are simple and easy to find. They give you about 200% of what you put in, while kiwis give you about 150%. Strawberry is another great option. It has about 90% of the daily value of fiber and extra fiber to help keep blood sugar in check. If you like fancy foods, there are many tasty options that are also high in vitamin C. Imagine a tropical ceviche made with fresh kakadu plums, salmon stewed in citrus, and red bell peppers. A 150-gram serving gives you more than 2,000% of your daily needs. Or try a 180-gram helping of Japanese tuna tartare with kiwi salsa that has over 1,000% of your daily value. Even a French-style acerola cherry sorbet with dark chocolate shavings can give you more than 800% of the vitamin C you need every day, and please your sweet tooth without making your blood sugar go up. What if food doesn't give you enough vitamin C? This is where vitamins come in handy. It is important to pick the right form of vitamin C because not all of them are taken the same way. One of the best choices is liposomal vitamin C, which works better because it gets into the system faster. One great choice for fast uptake is Livin Labs liposomal vitamin C, which comes in a packet with 1,000 milligrams. Pure encapsulations ascorbic acid capsules are also a good option. Each capsule has 1,000 milligrams of ascorbic acid, which is a simple but effective amount. A daily dose of 500 to 1,000 milligrams is enough for most people with diabetes. However, higher doses may be good when they are sick or when there is a lot of oxidative stress. Of course, you should always talk to your doctor before starting a new vitamin. This is especially important if you are already sick or take medicine. Also, it's important to know that some foods and habits can make a lack of vitamin C worse. A high-carb diet makes it harder for your body to use vitamin C because it stops vitamin C from getting into your cells when you eat too much sugar. Oxidative stress gets worse when you drink alcohol, which is already a problem for people with diabetes. Vitamin C is lost when veggies are cooked at high temperatures, so it is better to steam them or eat them raw. Another big problem is smoking, which quickly destroys vitamin C and leaves the body low on antioxidants. It's also harder to keep vitamin C levels stable when you eat a lot of processed foods that are low in fresh fruits and veggies. That's why it's so important to eat fresh whole foods and stay away from habits that make your body lose vitamin C. Getting enough vitamin C is one of the easiest ways to protect your heart, boost your immune system, and make insulin work better. It helps keep problems like neuropathy, kidney disease, and eye loss from happening. Making sure you get enough vitamin C can really help you control your diabetes and stay healthy. whether you get it from food or good pills. If you get infections often, heal slowly, or feel tired all the time, not getting enough vitamin C could be one of the reasons. The best part is that getting more vitamin C is easy and can taste good too. Change up your recipes and eat more bright fruits and vegetables to see how much better you feel when your body gets the nutrients it needs. You can see that taking medicine or cutting back on sugar aren't the only ways to deal with diabetes. It's about knowing what your body needs and always giving it what it needs. Vitamins B6, E, and C are not just small things, they are strong tools that can help you feel better, stay healthy, and avoid problems. You can take charge of your health and enjoy life more by paying attention to what you eat and making small changes. Remember that each step you take to eat better is a step toward a happier, better future. Thanks for reading. If you found this information useful, please join our group and subscribe to our channel. We're here to help you along the way, answer your questions, and give you more diabetes-friendly tips to make your life better. Please leave a comment below if you have any questions or would like to share your own thoughts. Let's work together to make it easier, better, and more hopeful to live with diabetes. Watch out for more videos that will help you grow with useful tips, simple recipes, and the newest research. You deserve to feel your best every day, and your health is important. Let's keep learning and growing together.